Hello everyone and welcome back to our YouTube channel. My name is Cora and today I have a little treat for you. We are going to go through some very common questions that I get as a pelvic physio from new mums or mums who are still expecting their babies. These are questions that I hear all the time in clinic. Some clients have even specifically requested that I make a video addressing some of these questions just so they can review it in future dates. So without further ado, here we go. The first and most common question that I get as a pelvic physio is it safe to have pelvic floor physiotherapy during pregnancy? And the answer is a resounding yes. Pelvic floor physiotherapy is how we train for the marathon of pregnancy, labor, and delivery. And even the postpartum phase, we can get a lot of really good work in with pelvic floor physiotherapy that helps new mums cope better, especially in the early weeks postpartum. We do this with a combination of education, talking about what is to be expected during pregnancy, labor, and delivery. We also do this with exercises, giving mom lots of active work that she can do throughout her pregnancy that helps just get the pelvic floor ready for delivery, and also helps to get the baby into the best possible position. We like this. We like making sure that mom feels really well supported and that she has the tools that she can use to empower herself, getting ready for pregnancy and labor and delivery. The second question that I get at our clinic here at Lumira, we offer the Emsella chair. And the question that I hear is the Emsella chair safe to do in pregnancy? And the answer is no. You do not want to be doing high fem technology during pregnancy if we can help it. There's some energy that comes off the chair. There's been no research to suggest that any damage happens to the baby, but why poke the bear? We're not in this to strengthen and tighten and work the pelvic floor too aggressively during pregnancy, but we want to make sure that we save that for postpartum. Just doing some simple breathing exercises throughout pregnancy can help prepare us for the postpartum phase. It is absolutely safe to begin the Emsella chair as early as 6 weeks postpartum. So once you've had your baby and you're 6 weeks postpartum, come on in. We can try the Emsella chair if that's something that's right for you. The next question that I hear all the time is how long after delivery should I wait to begin pelvic floor physiotherapy or resume pelvic floor physiotherapy? Let's say I've been having pelvic physio throughout my pregnancy. I've had my baby. How long should I wait after having baby before I have pelvic physio again? So the answer to that is we can begin physiotherapy externally anytime after having the baby, as long as you're comfortable coming into our office. A lot of mums will get some shoulder pain, neck pain, and that is safe to resume as early as, 48 hours, 24 hours, 2 seconds after delivery, whatever you're comfortable with. However, with pelvic floor physiotherapy and specifically internal work, either into the vagina or rectum, we recommend waiting 6 weeks just to give your body some time to heal. The pelvic floor goes through quite a lot during labor and delivery, so we don't need to poke the bear, make things worse. Let's give you 6 weeks, no one visiting that area, especially if there's tearing. We don't want to be introducing infection to the area. Giving your body some time to heal. 6 weeks postpartum, you can come in for some internal work with a pelvic floor physiotherapist. It is highly recommended to do that as well, just because then you can really start getting your rehab going. This is true if you've had a vaginal or a C-section birth, okay? So we want to make sure that no matter what kind of birth you've had, we are checking in with the pelvic floor to make sure that it is rehabilitating properly. So I always say, again, with the Emsella chair, 6 weeks postpartum, then we can begin our pelvic floor physiotherapy internal work. Externally, like I say, we can begin work right away, just as long as we're not introducing anything vaginally or rectally. Another question I hear all the time is, are there exercises I can do to help with pregnancy discomfort or getting baby into the correct position? And here I say another resounding yes. There are some amazing exercises that we can do. I have done videos on some general practices that you can put in to your everyday pregnant life to kind of help ensure that we are getting your body as a new mom balanced and getting baby into the correct position. So check out those videos as well. They're also a part of the mother load. There are all kinds of things that we can do from a physiotherapy perspective to balance the body. If your body is balanced, you have, good, healthy muscle tone throughout the body, not asymmetrical tightness on one side and looseness on the other side, we're going to naturally help baby get into the best possible position as they prepare for labor and birth. We're also going to help you be a little bit more comfortable going into labor and birth. There's all kinds of things that can happen to the sacrum as hips are starting to spread because of hormones. There's lots of ways that pelvic floor physiotherapy can help support that as well. So there's belts that we can use, there's taping techniques, there's exercises, things that help to keep the pain at bay, and help you, once again, as a new mom, feel empowered going into your later stages of pregnancy, labor, and delivery. Another question I get, this one is maybe a little bit more specific. Why do I have what's called lightning vagina? So lightning vagina is kind of like muscle spasms in the vaginal canal that often happen when baby gets a little bit bigger and starts to descend a little bit more into the pelvis. It just means that they're starting to compress some of the nerves and some of the muscles in that area. It's common. There are things that can be done about it. There's breathing exercises that can help you cope with the random sharpness of pain that can happen. Not every mom gets this, but it can happen. And if it happens, there are things that a pelvic floor physiotherapist can do to help. These would be a combination of breathing exercises, as I suggested, or also even just some hands-on techniques. So having a pelvic floor physiotherapist go inside and massage out tight muscles can help those muscles be less likely to spasm in the face of, a baby's hand or foot or head or bum compressing on it, or the nerve that innervates it. Another common question that I hear is, why do I have pelvic pain in pregnancy? So pregnancy introduces a slew of hormones in the body. So these hormones can soften our joints. They can make our ligaments a little bit more loosey-goosey and lax. And then the muscles look at that and say, oh dear God, batten down the hatches. We got to go into a spastic mode to protect these joints because now they're all loose. And sometimes that can be a little bit overdone. So the body can get into a little bit of a hypervigilant state, and the muscles almost overprotect, and they cause tension and tightness and restriction and pain. So we can get this pelvic pain in pregnancy, honestly, just because the hormones are introduced that help support baby, that help prepare the mom's body, but can sometimes lead to pain. So again, here's where pelvic floor physiotherapy can be super helpful in massaging out those tight muscles, teaching mom how to self-relax those muscles in a safe, healthy way. You're not going to just have your baby fall out of you, but in a way that we're not overworking the joints that don't need to be overworked. We're allowing the body to stay in a healthy status without causing any restriction or tension where it shouldn't be, which would ultimately lead to some of that pain. That pain is very common. It's very common to experience hip pain, low back pain, occasional pubic joint pain, twinges, sciatica-like symptoms. It's very, very common and manageable. It can be dealt with. There's all kinds of tools at our disposal as a pelvic physio, as a new mom, that we can help mitigate that pain. And the last question I want to discuss, maybe a little bit more specific to my practice as a pelvic physio, or the practice that we offer here at Lumira, is how can I better prepare for the birth of my baby? A lot of moms ask me, what can I do? How can I prepare for this? Is there anything I can teach my partner? Someone who is going to be there at the birth with me to help me get through this? And the answer is yes. I specifically have taken a lot of courses that a lot of doulas and midwives have taken, because I can then take some exercises and extrapolate some information there as a pelvic physio and teach partners how to best support mom during labor and delivery. So we learn hands-on techniques. I call this session, before I continue, I call this session birth preparation or mock labor day. So mom and her partner come into my clinic, have a session with me. It's about an hour and a half long, where partner can learn hands-on techniques to help support mom during labor and delivery, where mom can learn push techniques, not just the hold your breath, bear down, purple-faced pushing that we're all used to seeing on TV. We learn troubleshooting strategies, what to do if baby's not engaging, how to assess for things like nuchal hands, what to do if we're experiencing a compound presentation, or if baby goes transverse or breech. What to do in the event that an epidural changes the presentation of baby, changes mom's ability to move around. We also learn all kinds of labor positions that we're probably not used to seeing on TV that are much more valuable to us in preventing perineal tears, injury, much more valuable in not slowing labor down. We actually help to keep it going, keep the contractions consistent, keep mom feeling really empowered as she's continuing to move forward into her labor and her delivery. So there's so many things that we can teach partners to do. Instead of just having them sit in the corner and shout, push and breathe, we can actually give them tools that they can use to help support mom. And in turn, mom feels much more empowered to go through her labor now that her partner's kind of like a bit of a doula. So yes, there's tons of things that we can do for partner. Specifically here at Lumira, I offer a session, like I said, called Birth Preparation or Mock Labor Day. And it's just an education-based session where we practice all kinds of labor positions and push techniques and troubleshooting strategies. So if you have any questions, please feel free to reach out to me in the comments. You can also reach us through our clinic email and phone number. That is it for today. I would love to hear any comments you have about questions that you might have. We can do a second parter to this video. Let me know what you're curious about and how pelvic floor physiotherapy can support you during your pregnancy, labor, and delivery. Please remember to subscribe and like, and we will see you next time. Have a great day.